Today, about 1 in 6 couples have difficulty conceiving naturally. So if you find yourself in that situation, you are not alone. In vitro fertilization could be the solution for you. The IVF treatment involves several different steps. Boosting the egg supply. First step in the IVF treatment is boosting the egg supply. You will take hormones to stimulate the ovaries to produce 1 or more eggs. Collecting the eggs. When the eggs are ready, a very thin needle is passed through the upper vaginal wall into the ovaries. The fluid that contains the eggs is gently extracted from each ovary. Egg meets sperm. After a sperm sample is acquired, the most active sperm are selected and used to fertilize the egg. This is either done by mixing the egg and the sperm in a dish. This is called IVF. Or by injecting 1 single sperm directly into the egg. This is called ICSI. The eggs that have been successfully fertilized are now called embryos. They will be grown in a laboratory incubator for 2 to 5 days. Selecting the best embryo for transfer. While the embryos grow safely inside the incubator, the embryologist will monitor their development closely. This is done either by removing the embryo from the incubator to perform 3 or 4 brief evaluations, or by use of EmbryoScope, which is a specially designed incubator that takes an image of the embryos every 10 minutes, generating a time-lapse video. The time-lapse video allows the embryologist to examine the development of the embryos while they remain undisturbed in the safe environment of the incubator. The embryologist will then, based on the time-lapse information, select the best embryo and start preparing it for transfer. Sometimes genetic testing is also performed to make sure the embryo does not contain genetic abnormalities before finally transferring it into the womb. Back to the womb. The embryo that was selected for transfer will be placed into a thin tube called a catheter. The catheter is then passed through the cervix and the embryo is transferred into the womb. After transfer, the embryo has to rely on its own ability to implant. The 2-week wait. After the transfer, you will have to wait for 2 weeks before taking a pregnancy test. The average couple may undergo 2 to 3 IVF treatments before a successful pregnancy occurs. But once you get pregnant, it is no different from a natural pregnancy. Freezing for the future. During IVF, you may have good quality embryos left over. These can be frozen and used in potential future treatments. We share your dream.